Alrighty. As I said, we've got a pretty good crowd joining us, and I'm assuming that people will join us in a little bit. And we got an hour. I think we got a lot of good topics to talk about. So let's get started. I want to thank everybody for taking the time this afternoon to join us for this virtual town hall. I'm the host. I'm the 2020 chapter president. I'm Dan Hauser. If you are a member of the chapter, I want to say thank you. We appreciate your support. And if you are not a member, please consider joining us. There is strength in numbers, and I think stuff like this is what the chapter is all about: networking and learning from each other and all that we do in our day-to-day lives. I also want to thank the chapter-wide sponsors, Nuger Communications Group, BrandPoint, Weber Shandwick, and Padilla. We truly appreciate their support of the chapter all year long. So this is the first time we've done something like this, at least to my knowledge, a virtual town hall. I wanted to lay down a couple of ground rules as we get going here. I'm hoping that people will stay on mute until they are called upon, because if too many people start talking, then you know how these video calls go when that's the case. It might be best if you use a headphone or a headset on your desktop, your laptop, your mobile device. One of the reasons why we want you to be muted is, I don't know if you can hear it, but my cat is meowing behind me. But just to keep the dogs and the cats and the children and the cockatoos at bay while we're talking, that's a good reason to stay muted. I would ask that you send me an email. We're going to have our panelists speak, and then we'll open it up for questions, sharing anecdotes, lessons learned during the pandemic so far. I'd like to put everybody in a queue, so if you would send me an email at dhauser@mnmed.org. So again, that'll be DHAUSER at M as in Mary, N as in Nancy, M as in Mary, E as in Edward, D as in Delta, .org. That way I'll see who is asking, who wants to speak. I know there is a chat function on GoToMeeting, but I'm working on an iPad, and part of it is the slides, and the other is your smiling faces, and I want to see as many smiling faces as possible. So the less I have to check the chat, the better. So I will start with some introductions. As I said, we've got three panelists. We have Laura Hennon, and she has been a member of the public relations team at Blue Cross and Blue Shield of Minnesota for the past 7 years. She provides strategic communications counsel for the company with expertise in media relations, content marketing, and crisis communications. In her current role, Laura oversees the company's brand journalism strategy, which includes acting as editor of the Blue Cross blog and providing counsel for the team's digital communication strategy. Laura, maybe you want to just wave. All right. Second panelist is Alyssa Augustine, and she is the Senior Public Relations Director for the Federal Reserve Bank of Minneapolis. In this role, she is responsible for the bank's media and public relations efforts, both nationally and across the 9th Federal Reserve District. Alyssa, do you want to wave? All right. Our third panelist is Jennifer Baghdad. She is president and founder of PR and Spun, LLC. She advises and counsels organizations navigating change, and isn't this a lot of change? She also counsels on transition and transformation to communicate at their best when it is needed most. She has worked with a variety of public, private, nonprofit organizations, from global enterprises to local startups, counseling clients and providing communication and change management strategy and execution. As I mentioned, I'm the host for today, but I am embroiled in this pandemic. I am Director of Communications and Education Events for the Minnesota Medical Association. What our nonprofit does is advocate for the state's physicians and physicians in training. I can tell you that our members who are on the front lines are scared. They are overworked. Many of them are overworked, and many of are under-equipped, as you've been reading probably about and hearing on the news. But they are doing the best that they can to take care of the thousands of Minnesotans across the state, whether they, have COVID-19 or whether they just have a more common ailments. So my work has been basically 7 days a week, pushing out a lot of content to our members that helps them practice medicine, keeps them informed, adding a ton of content to our website and trying to manage that, and working with our leadership in interacting with the media, making sure that they have the proper messaging to represent us and communicate what we want to communicate. Before I pass it off to Laura, the one takeaway that I have in the pandemic so far, and it's nothing new and it should be not news to anyone who's on the phone, but how important each message that we disseminate is, because we're all getting inundated with a fire hose of content from every brand under the sun. And I continually counsel my clients and my leadership that everything that we push out needs to be pertinent and make our points, because the minute we start just putting out stuff just to put it out there, like a lot of brands I've been experiencing, people will start tuning out. So that is my my number one takeaway so far during this pandemic, and that's very important. So I will pass it off to our first panelist. Again, they will speak for a short time, and then we will open it up to questions. But Laura, how is this different from all the other crises that you've managed at Blue Cross and Blue Shield?
Thanks, Dan. Such a great starter question, and I was thinking about that question earlier, and actually, I'm going to share a little bit here. Actually, if I can share my screen, if I can make it work, this will explain it. You guys can all see my screen. It's different because it's so personal. This is a picture of me and my daughter, who's just shy of 15 months. I know a few people, familiar names on the line, have seen pictures of her from me sharing on Facebook. Last week, we were at Children's going through some medical concerns that we had with our daughter. She's great, but it was really strange because I just had a cold, and I had to wear a face mask because the doctors were concerned about, the doctor who we met with said, even if I catch a cold, I can't work, and I need to be at work right now, and he's not on the front lines of it, but all the doctors, everybody is so strapped, and it's so true that this affects, when you're in the middle of a crisis, which is interesting also to be talking on a panel in the middle of it, because normally we're reflecting on this, after it's done. It's not, it's like it's your whole world, but you might go home and your neighbors don't maybe saw it on the news, as and you talk about what you're doing as a PR person, but certainly someone you're going to talk to, like I talked to somebody I know in Sweden who's dealing with it. You don't normally have it where literally it's the entire world, and I think that's what makes this so different, is we don't know when the end will be, and it's everywhere. There's not a person on this planet who right now is not affected by this. So that's kind of where I would kick things off of it, just being such an interesting place to start, and to get into more of what we're doing with Blue Cross. Obviously, Blue Cross and every health plan in our country is dealing with this and managing it. So I'm just going to walk through a little quick timeline actually here of what we're doing. Let's see if I can actually shift this over to do full screen for you all. If it'll work, hopefully. So really quickly, kind of looking at sort of what this looks like. I mean, this has all been so fast and furious for all of us, and we really didn't know, like, is this actually gonna, come here starting in over in China, and but realizing that there was a very strong likelihood it would. So for us at Blue Cross, our first kind of toe in the water was in in late January. The first thing we shared actually was just an NPR story, which is pretty common for us to share news on our social media channels, and that seemed appropriate. And it was a really great story about reminding people about hand washing and the threat of the flu being greater. From there, we actually wrote a blog post. About that. I interviewed our chief medical officer and Gross wrote this blog post coming from him, again, with really great doctor's tips about, remember, the flu is the greater threat right now. Obviously, that has changed significantly since we shared that on February 7th. From there, we shifted into a very, very, very short, probably much shorter than usual period of preparation. On March 4th, and I'll show some of these actual full pages, we loaded our landing page as well as an FAQ blog post with our chief medical officer talking about how we're responding. And since then, and I'll show some of this kind of in the middle of it, which we still are today, and it's very strange to be talking about, like I was saying, in the middle of it, because we actually have some breaking news we just shared today, so I can't even share the media from it because it's too early. They're still working on writing the stories and telling what we've all shared about some coverage updates from today. So I want to just walk through, as I kind of said, the timeline, and the timeline isn't even done, and it's frankly far from done. So we quickly put news up. Originally, it was just actually a box on the right side of our landing page, and we about a week and a half ago, it's such a blur now, shifted to having this full yellow bar across the top of so it's really easy to find our information about what we're doing with coronavirus, and that's on this landing page we have here. Which is basically we tied out, we wanted to make sure everybody knew our main commitments. So one of them that we just, that's just announced today, if anybody saw the governor's press conference, you may have noticed it, all in-network related care to COVID will be covered at 100%, which was new. It was prior to that, we said, within network benefits, within standard plan coverage. So this is a no cost coverage. This has been a commitment by all of the health plans in Minnesota. You probably have seen some other nationals moving in that direction too. It's just in response to the nature of the pandemic. We knew it was the right thing to do and the smart move, and that's what we need to do. So we actually have just been updating these. This gets updated several times a week as everything is really just is moving through. But this has really been our hub where we're seeing consistent traffic of everyone coming here and seeing what we have to say. We've intentionally made it the most important being at the top of like what people care about, what our members care about is, am I covered? What am I gonna have to pay if I get this horrible thing? And then we also wanted to line into that community outreach is extremely important to Blue Cross as a company. So we have some community support, as well as tying into some more in-depth FAQs, which would be on our blog, and then making sure that we always, just as a business, tie back to the CDC, but especially in this case, it's even more important that we're always tying back to recommendations from them. Just a quick shot, you can see that, our newsroom, this is just our top 3. Everything is related to COVID now. We've had more news releases going out in the past month than we normally do, but there's a constant stream of updates. A lot of times we just put things on the wire, but we've actually also been really intentional about reaching out to a broader list of reporters than we might normally. We normally would have our key, maybe 5 reporters or so that we might reach out to with every release. This one is a much longer statewide list because of the nature of this being really the entire news cycle. Of course, we have everything on social media, and this is just to say, we want to make sure that however somebody comes to us, that they can quickly find the information that's most important. So this link is just back to our FAQ page, and it's pinned to the top of all of our social media channels. It's very important to us that however anybody is coming to Blue Cross right now, the number one thing and the only thing we can talk about as a business right now is coronavirus. And if someone's going to pitch me something for the blog, I'll say, that's great. What does it have to do with COVID-19? And I might not talk about it right now, and I might not talk about it ever because it won't be timely then. That's a little more evergreen, so it's going to be after we get through this. So those that I work with, everybody gets it. And so a lot of the stories that I'm having pitched and sent to me now have a COVID-19 tie very intentionally. As I was mentioning earlier, this has been kind of our main source. The one thing we really love about the fact that we have our blog is that it really is a great resource for both our consumers first and foremost, but also for the media, so people can get really more in depth and hear things in a different way than we share in a news release. A lot of what we shared in this blog post is similar to what we shared in various media releases, and that's great for reporters to see it, but this actually gets right to our members and right to consumers. As you can see, we first posted this particular post on March 4th and last updated it on March 24th, and actually it probably needs an update as of today because we just put out that new release about the coverage. So this is actually dated and I'll have a new date. Often we write multiple blog posts, but with the nature of this, we need one place where people can just keep getting the most updated information that is constant. So as you can see, we have a lot of questions. It's very intentionally from our chief medical officer. We want him to be the voice for this, and he's a trusted resource. We know it needs to come from a doctor. So that is really how we're kind of churning through this. Again, blog posts are usually like one and done and very much like you would read in a newspaper, but this one is acting very differently because it is really a source for our members. A couple other things that are interesting that we're really thinking about, as I was alluding to, that I wanted to share was a few of the more community impact commitments that we've made. The first one was our $750,000 commitment to Second Harvest Heartland. That was really an immediate response to realizing that hunger was going to be a very serious issue for a lot more Minnesotans. As we see people, we see it in the news all the time about how many people are out of work right now or facing other hardships because of this. And working with hunger and healthy eating has been a cornerstone of our community outreach for as long as I've been at Blue Cross, and certainly much longer than I've been there. So it's very natural way for us to do that. So we also talk a lot about health equity and health inequities, and we know that some of those that are going to be hardest hit by that are some of the people we're already working with in other ways. So this was a very natural commitment. It's $250,000 up front, and another $500,000 in matching dollars is the commitment we made. So we're really, really proud of that. And it did get some really nice media pickup. This is just one I thought I'd share. Story from the Pioneer Press. We had several media outlets, NPR News, Tom Cran covered it, did a really nice job, wrote a story of it. He was actually one of the first people to I think he even shared it on Twitter before we even had the chance. He was really excited about it, which was fun to see. This was the one that kind of threw us probably for the biggest loop. We thought it would get some media play. We thought it would get some media interest. It was beyond anything any of us ever imagined. This blog post has 140,000 views and counting. And to be totally candid, we normally get like 140,000 views in like 6 months or a year on our blog. I mean, it's just insane. People were so excited to find a way that they could really contribute and give back through this call to make masks. And the thing that's so great about this, that I really love about this story, is this came to life because we actually had a volunteer, actually a former employee who came to us, and Blue Cross has a group that's called Hearts and Hands. They're a knitting and sewing group. And like, we're hearing that there's this need, and if we can find some people to make masks, would Blue Cross help get the word out? And of course we said yes, and we're like, we'll put up a blog post. Ended up coming together on a Saturday. So I know my colleague Amanda's on the line, and she spent all of Saturday pulling this together. And a lot of us were chiming in. Bryce on our team too was also working. He supports our provider relations, so we're working with Alina. We have multiple providers who are interested in more coming and sharing it, and it's just been amazing in the media immediately. We put this out at like 4 o'clock on a Saturday. It went up on our blog. We did the same media push that we've done to a list of reporters, and we were on the evening news. I don't know that we made the 6 quite. Amanda would be able to say that for sure, but we definitely made the 10 o'clock news that night, which is just insane. As you would all know, on a Saturday night, you're sending out something, at 4 o'clock to the weekend news, and you're like, what? Like, this is so against what we'd ever do, but it was timely and it was going to do it, and then it was in the news cycle for several days, and of course, New York Times picked it up and gave Alina a really nice shout out about it. So we were pleased to see that too, and it was just really amazing to see how something that was so grassroots and so, like, we do a lot of community outreach, but normally it doesn't, we're happy if we can get maybe one story out of something like this. This was on, I think, every network. It was just absolutely incredible. We were so pleased to see it. Here's a piece of it. It was on WCCO. Apparently he's doing the forecast now, but there was a nice clip of it there. And then also, I think probably, I'm guessing many people online know Eric Hansen. He's a dear friend of mine. I'm sure he's a dear friend of many of yours. And he reached out and wrote a really nice post on his blog talking about the difference we're really making. And he really nailed the intent of what we were going to. And I was actually really flattered to see that Eric said they're even responding to all the comments. We have 200 comments and counting on the blog post about it. And it was just, I mean, it's just, we never, you know, we usually get maybe like 1 or 2 comments. I mean, people don't really comment on blogs all that much. I mean, and we're trying to be helpful. I mean, people have really relevant questions, and it actually helped us update the blog. So we stopped answering the same questions over and over again so people could find what they need. But man, those Minnesota Sewists, I learned it's Sewists, not sewers. They are committed bunch, and it's just super heartwarming to see. And we really, we're glad. We had a huge sharing over Facebook. I mean, sharing directly from, you know, within the tab here on the blog within Facebook, as well as Facebook itself, like 300 and some shares. I mean, it was just really phenomenal. We were so happy to see that. A couple other quick examples of things that we've done that maybe make sense just for social, for us as a brand, but not a bigger thing. We're talk a lot about health equity and inequities, and part of that we talk as a company, especially through our Center for Prevention, a lot about the realities of racism in our communities. And so we did a quick share of this really nicely done video around the xenophobia that's occurring because of this. And we really feel from a social impact perspective that that is a very important message that we have to be reminding people of, not just your coverage, but also the impact it has on people directly in our communities, as well as reminding people from trusted resources, pay attention to what the FDA and the CDC are saying, that home testing kits, you know, that people are getting these things and they're not approved by the FDA, and they're not reliable. So, you know, find the right resources. That we find is really important for us as a company to share. One other quick community-based one is our foundation. I mean, often in a crisis, we don't have our entire business sharing it. It's not usually Blue Cross Center for Prevention and the foundation and the health plan. Usually our foundation or our health plan are trying to avoid our crises because they don't want to get caught in the middle of it, but they, you know, this is so different, and they're doing, you know, some grant making as well. So another really great example of how this is just so different than any other crisis that we've ever dealt with. Today, as I mentioned, you know, this is the late breaking news that I can talk about because it's actually real now. So it's live, is that, you know, we are covering treatment. So in-network treatment is going to be covered at 100%. So if you have a Blue Cross plan, that might be reassuring to you if you're worried about getting COVID. And then of course, I'd be remiss to not say too that of course it's also really important that we're partnering very, very closely within the PR team with our marketing team. So we've had just 2 emails so far about it. I think everybody has gotten an email, including from like your auto body shop, and everybody's tired of it. So we are being very selective in what we send out and making sure it's really relevant. So this email, I think, is actually just going to be going out soon. I don't even know if they've been able to hit the send on it because this was just announced today, but reminding people that COVID treatment is covered. So we're really, I mean, we're all in it together. It's 100% of our company, and we're all working remote. So it's just, it's totally different than anything else, but it's amazing and heartwarming to see how we've all come together to do that. So that's the Blue Cross story to date, and I will pass it along to the next.
Thanks, Laura. Well, I'll admit that I was one of those views on that mask making content. So that was great.
That's great. So, thank you for reviewing it.
Sure. I'm going to pass it off now to Alyssa. And if you could tell us about how your work at the Fed is tied to the COVID-19 pandemic.
Thanks, Dan. Yeah, so as Amanda, Laura just indicated, that this is a public health crisis primarily, right? But the solution to the public health crisis created an economic crisis. You know, we're all being told to stay in, don't go anywhere, where restaurants are closing, stores are closing. And so that's created a real problem economically for the country. And as the nation's central bank, it's really, it's fundamentally our job to kind of pull the right levers to make sure that the economy is functioning. So the Fed has taken a lot of steps, unprecedented steps, to try and mitigate a lot of these problems, even though, as you know from maybe some of the news today, that our jobless numbers are through the roof. They're numbers that we've never even seen before. So the Fed is busy trying to mitigate as much as we can. In normal times, we operate in the background for people. You probably don't think about the Fed every day or ever, maybe, which is okay if you're not thinking about us. It probably means that we're doing a good job. It's when things start to get a little tricky in the economy that people are like, what is the Fed doing to kind of mitigate this problem? So right now we're feeling very front and center, I think, for a lot of people because, the economy is struggling right now. So all that being said, our media interaction is typically pretty focused. Like Laura said, they're interacting with a handful of reporters at any given time. That's true of us too. Our work can get pretty wonky, and a lot of people, it just doesn't impact you day to day. But now it seems like it does. And so we're in times of economic crisis, and especially since the 2008 recession, it seems like the public and the media at large kind of turn to the Fed to say, tell us what's going on, like why are there problems, how are you going to fix them? And so that's how we're not central, right? We're not healthcare workers, we're not, Blue Cross Blue Shield, but we are right on the edge of that core of the response to the pandemic. And so we, while a lot of business is slowing down, we're really ramping up in terms of how we're responding. And I think this is always true, but it's especially true now that if you work in a business that can get complicated and really technical and wonky, I think it's always true that you want to do your best to communicate these ideas clearly and simply so that anybody who picks up the paper or turns on the TV can understand what you're doing. And that's something we always try to go for. It's harder to do sometimes, especially given the kind of stuff that our economists are thinking about and talking about. But I think it's especially important in times of crisis. And there are two things that I feel like have been guiding how I think about how we interact with the media right now, what stories we're focusing on. And we want to convey to the public and to the country that we want to convey a sense of stability and we want to convey a commitment to public service. And those are the two things that really, I think, have, in my mind, been driving how we interact with the media and what we're communicating externally. And so early on, and I say early on because early on for us was kind of February-ish. We're not healthcare workers, obviously, so we totally understand that medical professionals are thinking about this well before most of us probably were. But I think early on for us was in February where the Fed has reporters who watch our every move. They parse every word that Fed presidents say because it's potentially market moving, right? So you can, sometimes you'll see in the news that like some comment that some Fed president made stocks go up, they made the market like volatile. And so we have to be very careful about what we do and what we say publicly. So we were trying not to, even as we were as a system considering a work from home stance, we had to be very careful about how that was communicated because we didn't want to get ahead of the CDC before, for a certain amount of time, the CDC was not recommending work from home. And so we were balancing employee safety, like, many organizations were trying to do, but we were also realizing that I already had reporters calling, asking, are you guys working from home yet? What are you doing? Tell us what you're like, are you telecommuting? What's going on? And so if we got ahead of that, it could make it seem like the Fed knew something that everybody else didn't. And so we were trying to be, I mean, it's a dance, right? So you have to be kind of careful about even these operational decisions that you make can communicate something that maybe is not intentional. So we're trying to be really careful about that early on. As things progressed, and we moved to a work from home stance, we really wanted to emphasize that we were taking in as much information as we could. We were constantly evaluating the situation. We were constantly evaluating the economy and I think I think it's probably hard to convince people that an organization like the Fed is super nimble and can respond right away, because historically we haven't. But this was we've been making a transition in terms of our public communications to say, like, we're listening, we're open, like, we are transparent. And so we've already been kind of moving the ship that way, but it was a whole new ballgame when this happened. It's like, okay, we're here, we're listening, we want to know what you guys are seeing. We're listening to the public health authorities, and we're trying to balance all of that stuff and making it clear that, that was really guiding our communications. And another thing is, I think people want to know, like, if I go to my ATM, can I get cash out? Should I go withdraw all my money? If I pay for something, is it going to go through? If someone writes me a check, is it going to be processed? And so, in that regard, when those things are working, you don't wonder if they're going to work, right? But if it comes up that, oh, there's a crisis, or is somebody going to be there to process this payment, or is there going to be cash in the bank when I go and try and get it out? Then it's like, okay, well, what's the Federal Reserve doing to make sure that that happens? Because we oversee all those processes. So that was sort of we wanted to emphasize that our operations were continuing as normal. Again, focusing on that stability message and our commitment to public service, that we're still here, everything's fine. You don't need to run to the bank and withdraw all your money. It's okay. And I think that was one of the things our bank president was on 60 Minutes a few weeks ago, and that was one of his messages, was like, it's fine, there's plenty of cash. You don't need to go take all your money out and put it under your mattress or put it in a safe. The Fed is here, we're keeping an eye on things, don't worry. And so that's been one of our main messages too, especially as more people in the public are paying attention to what we're doing and saying. And now we have, I know one of my colleagues is on the call, Paul Wallace, and he has helped a lot with this effort. Now we have created, this is our homepage that I'm sharing with you here. So you can see it's the top line item. It's a huge banner to say, we are doing everything that we can to help mitigate the economic circumstances that we're all facing right now. So here's a page that we've created. And we have tried not to be a fire hose. I'm trying to click through and I'm not sure it's working. There we go. We've tried not to Dan's point, be a fire hose of information. One of the things I think we've really spent a lot of time thinking about is, what can the Minneapolis Fed in particular bring to the messaging about this? And so here is a message from our bank president. One of the things that I think is always true as you're interacting with the media and trying to find your place and a spot in the communications world is that you need to find your angle, right? You need to find your niche. And I think we have a leader who is unique in that sense because his name's Neel Kashkari. There's this picture there. He was the person who ran the TARP back in 2008. And if you remember the TARP, that was the bank bailout program. So he is sort of an authority on recessions. And because we started pitching that angle early on, and he was very vocal about, lessons that he learned in 2008, 60 Minutes called, and I answered, obviously, because you always answer when 60 Minutes calls. And so that was a really successful interview that we had. And we got a lot of positive feedback about that, to say, it was comforting to hear him talk about, we made it through 2008. We're going to make it. It's going to be tough, but we'll be okay. So this is our page. We've got a message from him. We've posted some of the media here that he has done. And then part of our job at the Minneapolis Fed is to monitor the regional economy. And so a lot of my colleagues have sort of shifted, given everything that's going on, to think more about how COVID-19 is affecting businesses across our district. And then we've tried to keep this, like I said, avoiding the fire hose of information, because we are in the information business, right? So it's a slippery slope. But we've linked some resources here, as well as some federal resources, and highlighting some of the research that our economists are putting out, along with media that has been done so far. So, you know, like I said, I think there are a couple of lessons that I think we all think about this a lot, but it's really become very apparent how important it is to find your niche, whether it's a person or data or service that you can offer that differentiates you from, you know, peers in the business. I think this has also helped us focus our limited content creation resources. We're a small team, and it helps us make better media decisions. And then find ways, especially in a time like this where maybe you have a lot more journalists calling, depending on what you do, find ways to tell the story effectively to different journalists. The thing, like in my experience, the way that we would talk about something we're doing to the Wall Street Journal is a totally different, you might be telling the same story, but you need to find a new way to tell it to, you know, somebody from a local TV or print. And I think that's always in the back of our minds as we're communications professionals, but it's especially relevant to me now as we're trying to get our message out to as many people as possible.
Great, thanks, Alyssa. I think the call from 60 Minutes might be the most exciting call to take and the most frightening to take.
Yes, yes. I'm pretty sure that was like the highlight of my career, and if everything ended tomorrow, I would be totally fine. Like, that was pretty cool.
Excellent. Well, not to make a comparison, but I once got a call from Inside Edition, and they thought they were calling the mixed martial arts MMA, and it was us. So wrong call.
Oh,
Anywho.
well, you know, that's
All
I
right.
like that story.
Thanks. All right. So when we were putting this panel together, the first two industries that really came to mind for the organizers were healthcare and finance. But then we started thinking, it's like, what about all those sole proprietors that are out there and that are chapter members? And so we turned to Jennifer now, who's got her own business. I guess I'm curious, Jennifer, what did you see with your client work when this hits? And what do you expect to see in the weeks and months ahead?
Thanks, Dan. Yeah, it's a really interesting time right now. And I think the name of the game has been pivot. So as we started really around the week of March 9th, is when the world seemed, in the United States anyway, the world's events came to start hit close to home. And as it really hit close to home, we saw a little bit of a domino effect of what was going to be happening, because we were taking lessons, right, as the United States, taking lessons from what was happening in Italy, what was happening in China. And the week prior, maybe it was the week of March 2nd or so, you know, everybody was just talking about it, but it was really business as usual. All my projects were still on task. And it was almost as if we're thinking that was happening, but if we're just strong collectively, we'll be fine. It's not going to happen to us. But then I think the really pivotal moment for me was when the NBA canceled its season. And that was March 12th. And as soon as that happened, it became a domino effect. And the following week, for my clients, it became all about changing away from the project work. So it was focusing very specifically on all COVID, all the time. Projects, I don't want to say they stopped, but they were paused. That's kind of the terminology we've been using, is to pause what we were doing, and it was all hands on deck for communication on COVID. And it was teams working together. So as an independent, it's interesting because, you know, people generally say, oh, it's so isolating to work, you know, as an independent, you're by yourself. But that really positions us super well in this time of crisis, because we can help personally and we can help professionally, because we understand what it takes to work and spend your day being from 9 to 5 or 8 to 6 or 7 to 10, you know, depending on what's going on, working weekends. And we're able to help provide those tips and provide that feedback to clients. So right away it became, I work a lot with internal communications. That's the function that I focus on, internal and change. And so it became right away, what kind of playbooks do we have? What kind of playbooks do the clients need when they're getting, as you heard, actually, all three of you, Laura, Dan, and Alyssa, have really been talking about all of the things that have been hitting them from across the board. So how to keep employees healthy and safe, how to keep operations going, business continuity, how to plan for crises, how to manage your external stakeholders, your customers, whoever is at your door. And you see that with across the board, almost no matter what industry you're in, and certainly some industries have been hit harder than others, and managing, especially those who are considered essential employees when you're dealing with a remote workforce in many cases, but also in some cases, a workforce that has to be on a line, or, still considered like the grocery store worker. So it was the first week was really spent getting those playbooks in place, getting crisis action teams set up, putting together communications that were pretty focused on the tone and the right tone and the right style for the moment. And that meant quick. It meant straightforward. I mean, we all as practitioners try to focus our communications to be very simple and moving away from corporate speak, but now more than ever is communicating quickly. Some of the conventions, like Laura was talking about, in terms of communicating on a Saturday and getting that news picked up, the conventions of communicating something important. I was working with my clients to really throw those out and to keep throwing those out. It's about communicating what we know when we know it, which is actually often a principle of change communication as well. So it's communicating what we know when we know it to keep all of our stakeholders informed. And as the weeks have progressed, and I'll admit, I think March, and for all of us, March has probably been the longest month ever. And as the weeks progressed, it became about, all right, now we have the plans in place. What are we seeing? How are we managing the incoming and the changes that are happening every single day, sometimes every single hour, to get that information out and serving as that resource, doing what we as communicators do, connecting folks and serving as that resource for our leadership, for our operations teams, connecting finance, HR, in many, many cases, marketing, and communications, just to get everybody talking together on the same page and thinking about what we had been doing in previous kind of crisis related situations and how to carry forward what we do and how we do it, who we are in our communications going forward. So looking ahead, it's really hard to say right now. A lot of the work that I'm seeing with my clients is, at this point, too many unknowns of when this virus is going to take a turn, when things were going to get back to normal, what that's going to do to the economy. I was on a webinar actually earlier listening to Neil talk about the different economic curves and, what the best projections could look like versus the worst. And so now that's what we're doing with my clients, is looking at what are the projects we can kind of pull back from that pause and maybe move forward incrementally or in the right way at the right time. Think about how we can replan, repurpose some of the things that we're doing. If some of the projects do require more of a pause than others, it's planning for how to bounce back after this is sort of comes to a point where it's over. And that's really been where we've been spending the majority of time, is innovating. And we can take examples from all over the place in terms of our innovation. I mean, the restaurant industry has pivoted quicker than they probably ever pivoted before. So just in trying to make sure that they maintain relevancy So that's exactly the same kind of things that my clients are doing, is looking at how they can deliver products and services to their stakeholders, and how I can help support them and help innovate right alongside them to get that information, and with their employees, make sure their employees are feeling taken care of, because in this time where everybody is isolated, it is really about being together. So, and focusing on that messaging. So I'll turn it back to you for questions, but that's where things have been on the independent side.
Well, thank you, Jennifer. Appreciate your input and wisdom that you have been able to share with us. We're going to open it up to questions, and oh, good. And on the screen, you can see my email address. Send just a note quick to me to get in line. We're going to start with, I think David Shanik had some comments and/or questions or short stories to share. David? He went offline. All right, I'm going to call on people. I'm curious if somebody from a large agency would like to address it. How about like Leah Condis?
Hi, Dan. So my question isn't for anyone in particular, but I feel like there's a tension between public health and the economy. And I'm wondering if anybody wants to weigh in on how they're handling that tension. For instance, I'm thinking of last week when the governor made his executive order about shelter in place, and there was something in there about essential business. Well, all of a sudden it was like everyone is up in arms, right? Trying to define what's an essential business, or making a case for continuing to operate. And how do you balance that with maybe the concerns of your employees who are like, why are we at work? So does anybody want to comment on that or have stories to share?
I'd be happy to start. I'm obviously going to be very biased because, you know, we advocate for physicians, and we've been petitioning Governor Walz to instill the shelter in place, because the people that are on the front lines are very concerned, and aptly so, about having too many people get sick at the same time. You know, about flattening the curve. And so, you know, if we can flatten the curve by having more people shelter in home and stay at home, Minnesota, hashtag, that will slow the pace of the need for critical care at hospitals and whatnot. So we've been advocating for that, and we still I'm still hearing from some of our members that are saying this is not even, people aren't taking it serious enough. That and you see articles. There's an article in the Strib today where they're thinking about closing some of them, like around Bede-Makaska and along the riverfront, where there's just a lot of people that are congregating and not adhering to the 6-foot rule. So, you know, we have a lot of members that would like it to be even more strict so that we can get you know, to slow the spread, as they keep on saying. I don't know, Laura, do you have additional comments?
I wouldn't say anything specific to the economy. I mean, we definitely are supportive of everything as far as slowing the spread and really thinking about, you know, talking about health. And again, our reliance, because we certainly have doctors and plenty of doctors on staff, but as a health insurer, our reliance for the best medical advice is really leaning into what is the CDC saying, what is the FDA saying, and what can we do to keep putting forward that best public health information, which is also challenging too. I mean, I guess the area with economically that we do fall into it is the cost of care, which is why today, you know, we made the big commitment to that if you do come down with COVID-19 and you are hospitalized, I mean, it's a huge medical bill, and that's going to be covered for you. That's a pretty big commitment, and it's one that's been asked about a lot of health insurers. So, you know, from the economic standpoint, that's really where what we're trying to do is we're going to take a huge burden, you know, on the cost of claims that we're probably going to have coming in, because this has gotten really big, because it's the right thing to do, and we need to take care of our members, and knowing, you know, people are, you know, out of work and there's so much going on and a lot of fear, even if you still have your job. So I think anything we can do to ease that burden is the point where we come in from an economic standpoint. And then just really emphasizing the best and most recent public health information and encouraging people to follow that is what we're sharing from that perspective.
Alyssa, do you have anything to add from the, you know, economy point of view?
Yeah, and I think, you know, this is, it certainly appears like we're heading into a recession. And it's different because it's not like 2008 when there were people maybe not making the best decisions, right? That led us into a recession. This is more of like, I've heard the analogy of a medically induced coma, right? We're trying to, the solution to the public health crisis effectively creates an economic crisis. And so one of the things that I know our bank president has been advocating for in the media is relief for small businesses, that, you know, some kind of forgivable loan that they could take on that would be forgiven if, excuse me, if they maintained, you know, a certain percentage of their workforce until this is all over. So at the Fed, our president has really been putting forward some solutions to make sure that people are incentivized to keep their employees on, to sort of minimize this conflict that you're speaking to.
David, I see you're back online, I think. Did you have a question? You're on mute, so I don't know if that's...
Sorry, I've been having some technical issues here. A couple of quick comments. Number one, we've been at the Red Cross spending probably 2 to 3 hours a day in conference calls, getting set up to do a number of things about the response to COVID virus. A big thing which you've been seeing a lot of press about is the continued need for donors, for blood donors. We're asking people to make appointments. We have made a number of changes to the process to help with social distancing during the donation process, but we need everybody on hand. The good news was that we exceeded our goal in March by over 1,300. So that's a tribute to the Minnesotans coming out. We've changed completely home fires. We did 60 home fires in March, and we were serving about 180 clients. But now we've switched over to what we call a virtual or remote response, so that instead of physically going to a home fire site, we are either gathering information by phone and then arranging a drop-off of our what we call our client card to the victims, so that literally no contact is made. And oh, by the way, last night we served 32 individuals in a complex fire up in North Minneapolis that included 21 kids. So that is an ongoing and continuing basis, but that was one of our first big virtual type responses. We are working, if needed, to have safe sheltering needs if there are needs for sheltering, congregate sheltering. But again, we will be working with our public health partners to establish proper guidelines and proper questions to be asked and temperatures to be taken and so on at admission to those shelters. And that is going to be our last resort. We are going to try and put up people in hotels or dormitories or other facilities before we would start sheltering. The last thing I'll just note is that we now have the great ability and are in great need of virtual volunteers, including public affairs volunteers. And so if anyone is sitting around at home thinking about, gee, I'd like to do something to help, if they could contact me, we can do virtual volunteering, which involves taking shifts to be on call for these responses and to make appropriate news releases and contacts with media to let folks know about the Red Cross response.
Thanks, David. That's a great idea. It's maybe something that the chapter can put out, through social media to look for those public affairs volunteers. So
absolutely.
Yeah.
I was going to say, David, you'll be happy to hear too that that Blue Cross had a really successful blood drive just recently, and it's been something we've been talking about internally for sure, as we do regularly. We have blood drives right on our campus, but we've really been talking about that. I'm sure there's a lot of other companies that are doing the same, but that's such a huge need, so I'm glad you noted it.
Every drop counts, and we do have 4 that are going on with our partners at Mall of America. They're actually reopening the mall for us for 4 days to do blood drives. But we are, again, urging people to make an appointment first, because then that way that ensures that we have enough responders there to take care of the crowd, and also that we don't have large crowds of people gathering who are waiting to get in.
Thanks, David. Amy sent in a question. It's an interesting question. I certainly don't have an answer for it, but I'm intrigued by it. So Amy asks, are organizations rethinking their open office plans? Germs spread more quickly among open office plans and not as quickly in Cubeville. Anybody heard any kind of discussions where they work about this concept?
No, I'll say that I think my clients are really focused on the first response, on the crisis response right now. So I think it's a really interesting question, though, and I wonder if it's something that as people start to get back into the office, they're going to think about, because already in some places where folks are on a line or in a facility and are closer than 6 feet together, they've had to rework how that is the layout where just physical employees are. And I think it'll be really interesting to see, but I think it's been a little premature for my clients to be thinking about it, especially if they're still all sitting at home. But I like the idea personally.
I think that the forced remote office setup now is going to make us kind of evolve more quickly than we would have normally, and I'll be curious to see when everything quote unquote goes back to normal, how many people continue to work remotely, and maybe all the introverts and the extroverts like me will need to go right back to the office. But it'd be curious to see, how things evolve. So we are about 1 minute before time. I want to respect everybody's time, to go back to work in their home office or to tend to their family, walk their dog, go outside before it starts raining, and maintain a 6-foot perimeter. I want to thank Laura, Alyssa, and Jennifer, and for their information and their content. I want to thank everybody for joining us today and taking an hour out of their busy schedules to talk about this. I am really, really curious to see what people think of this format for the near future. This is how we might engage our members. So feel free to send me an email and comments, plus, you know, what the pluses were, what the negatives were. I'm all ears. I would love to hear your, see your questions and your comments. So thank you, everybody. Stay safe, stay home, and we'll all get through this together, but apart. Thank you.
Everyone.
Thank you.
Thanks, everybody.